Hear from Kristen about beep. I hope she's going to tell you what beep is.
Yes. Hello everyone. For those who don't know me, I'm the grade 2 physio that works in the early rehab stream but works predominantly in the ONJ. So I'm really excited to present my project today because it's been a 2-year project that I've been planning and it's finally gone live. So BEEP stands for Breast Cancer Education and Exercise Program. So how did BEEP come about? Basically it was me having a light bulb moment about 2 years ago and working out what was actually happening on the wards and where we were spending all of our physio time. So up until a couple of weeks ago, all of our physio time was spent on inpatients, and that was historically built into when ONC was on 9A and C, and I was finding some trends on the patients that I was treating. So I was finding that the patients that were presenting on the inpatient wards were already on that slippery slope. So a lot of the patients that are admitted to the hospital are nearing that end of life care period, or they're already starting to decline functionally because of their disease trajectory, or they're not responding to their treatment. So not saying that we play a big part in discharge planning there, but basically, is this all we could offer? And I was really questioning the timing of when we were giving the physio intervention. So I questioned that and had a look at the evidence. So basically the evidence is saying that exercise should be happening at diagnosis if it hasn't already started. So when I'm seeing the patients on the ward, they're well beyond that point. So they should be exercising at diagnosis, and particularly during their active treatment. So there's a lot of evidence to suggest how important exercise is during chemotherapy. So looking into that a bit further, it became really obvious that in the breast cancer population, there was a correlation between exercise and improved prognosis and chance of remission, which is absolutely huge. And it was evidence that patients started to access themselves on the internet. So once they were given a diagnosis, they were looking at that and thinking, why haven't I been offered that service where I'm getting treated? So a lot of patients started to ask a lot of questions, and I started to get a lot of calls and pages from doctors saying, what can we offer our patients? And this was also in lieu of a Catalyst video that was released on ABC 2 years ago this month, which was really powerful and showed that message. So as well as those benefits, exercise has also been shown to reduce the side effects of people going through chemotherapy. And that also relates to how they have improved prognosis. So if a patient is tolerating their chemotherapy quite well, the oncologist doesn't have to dose reduce the chemotherapy, so they can get their full dose of chemotherapy in that spot, and that's what they're intended to do to kill those tumour cells. Also, the other question that lots of patients are asking is it safe to exercise during chemotherapy? Patients are really aware and don't want to jeopardise any chance that they have of getting a full recovery, but all the evidence says that it's completely safe and there's no actual adverse effects. So the oncologists like to say the cliche thing, if exercise, all the benefits of exercise were in a pill, pharmaceutical companies would be making millions, billions. So what's the ideal? So my ideal notion is that we create a culture change in oncology, in the space of oncology, and that exercise is not seen as an additive anymore, but it's becoming an integral part of standard care. So that culture change has to come from the top down, and that's what I've been working with the surgeons and the oncologists to sort of get them on board with this picture, and also to promote it with the patients. So the patients take time off work to come and do their chemotherapy. They should also be taking time off or making some protected time during their routine to also exercise. So what was the pre-situation? So I knew some sort of program would be beneficial because nothing existed up until now. So that was definitely a change. And I needed to start somewhere because oncology, how it works is it's all in different tumour streams with different consultants and different teams. So I started with the breast, population because that was where all the strength of evidence was. And it was also a tumour stream that's quite well supported. They've got breast cancer liaison nurses, which advocate for the patient and are really highly involved with their care at Austin. So pre-implementation, I had to look at some data and see whether it was doable. Basically, at Austin, there is approximately 200 newly diagnosed patients with breast cancer, and about 50% of these receive chemotherapy. So the other 50% either just have surgery with some radiotherapy or some immunotherapy or endocrine therapy. Before I went any further, I also liaised with a group of consumers. So I got their names through the oncologists and they were pretty happy to talk to me. They all identified that if they had the chance to exercise during their chemo, they would. At the time of me talking to them, they all weren't meeting the recommended exercise guidelines, which is standard for any population. So that's that 150 minutes of moderate intensity exercise or 75 vigorous per week, plus 2 to 3 strength training sessions. So they were definitely not meeting them during their chemo, and they were definitely not meeting them at the time that I spoke to them. They all identified the importance of having options. So a lot of this cohort work still during their chemotherapy, and all of them that I spoke to in this group were mothers. So they identified that they had a lot of other commitments other than just work to deal with, as well as the emotional burden of having a new diagnosis of cancer. I benchmarked other similar services. Unfortunately, a lot of people didn't get back to me with my survey, but I did go and have a look at a outpatient program at Epworth, Camberwell, and just had a talk to the people that set that up and the patients. And the other thing I had a look at was outcome measures. So I didn't want to make this really hard on the patients, and we weren't actually testing that exercise worked. We were just testing that a program could be implemented into our service. So I chose a self-reported measure, which is the Global Physical Activity Questionnaire, and it's a questionnaire that patients fill out, and it maps how close they are to their recommendations. How long do I have?
Another minute.
Cool. Oh, sorry. Whoop. Okay, so what did I do? I'm going to talk really fast now. I did an extensive literature search. I had to get the stakeholders involved. I applied for an NMICS grant and was successful in getting that. I had to go through ethics and submitted it as a QI project because we weren't testing an intervention. I had to plan the logistics and the contents of the program with a lot of help from the EPs and Megan Howard. And I also had to market my program. So I put a lot of signage through the ONJ, and I also made a patient brochure. So what does my program look like? So all referrals come to an education session, which is run by myself, and it goes for an hour. And then they have 3 options. So they can opt out, they can attend a supervised gym session twice a week with myself and an EP that runs on a Monday and a Thursday, or they can come to me on a one-on-one session and get a home-based program, and then they're followed up with me for 8 weeks on the telephone. So limited results so far. We're 7 weeks into recruitment and we're 4 weeks with the program going live. So far we've had 21 patients being referred. 6 immediately declined for a number of different reasons. 11 have attended the education session, so I've got 4 that chose the home-based session, that they've all been delivered and I'm coaching them over the phone. 7 have chose the gym-based session and 4 are planned to come this Friday. So the next step is to evaluate the program. So Mel's really helped me with this process. So we're going to evaluate the program probably in another 4 weeks' time at week 8 to see if we need to make any changes. I should have said at the start, it's a pilot trial for 16 weeks. So we've got that opportunity to see if we need to make any changes for the second half. My prediction is we probably might need to make some small changes for the second half, mainly around how the oncologists refer. They are hit and miss from week to week. And I'm also looking at extending this sort of concept of outpatient exercise to other tumour streams. Just quickly, my insights. It's really important to find yourself a champion. I was really lucky to get Belinda Yeo, who's the head breast oncologist here, and she's really promoted my program with the breast oncologists and the surgeons, and she's also spread the word to Peter Mac, so they're really interested in the program and wanting to explore that as well. Just try and be patient with the planning process. For anyone that knows me, I'm a stress head and a control freak, so I just wanted to jump to the end. I knew what I wanted to do, but you know, going through the 2 years, I really systematically went through the process and knew by the end of delivering the program, I knew that it was evidence-based and it was the best that I could do with the resources that I had. Celebrate the wins and reflect on what you've achieved. It's really easy to sort of lose motivation at times, particularly if there's barriers involved. And be flexible with time frames. Sometimes things happen out of your control and you've just got to grin it and bear it. Thank you.
Thanks, Kristen. I hope I didn't slow you down too much. I am also a bit of a control freak and I trust in the process, so sometimes you do have to take your time. And in fairness to you, there was a big chunk of time in the middle where Nemix, who'd said they'll give you money, then said, please press pause and wait. And I think that bit was well and truly out of our control. But we've got to a good place and it's really exciting that you've gone live. So thanks for sharing the story so far, and we look forward to hearing how you go with the next bit.